Go.
Okay, hi guys. Today we're going to really quickly review the differences of a surgical mask and an N95 mask. We're hearing a lot of talk about N95 with the COVID-19 virus. So I just want to touch base really quickly. First, we're going to talk about a simple surgical mask. It's usually pretty thin, ear loops, opens up, and it has a foldable metal bar right across the nose. When you put this on, guys, you want to put it behind your ears. Make sure that you get a nice pull down on your chin, and then go ahead and fold that metal piece so it's nice and tight across your cheekbones to prevent any particles from getting in there. This is the kind of mask that you would wear in the event of somebody having influenza or a GI illness, something with a large particle type of transmission. Now, with COVID-19, we hear a lot of talk about N95, and that is a type of respirator that filters out very, very small particles. And COVID-19 is a very small particle virus. So we want to talk about N95 masks. They come in a variety of styles, different fits for different shaped faces, because it's very important that the correct N95 mask that you have fits your face really, really well. So a couple of things that we want to go and show you, sorry guys, is it's going to be a tight fit when you put it on. Straps up in the back. Make sure you've got that good seal down below your chin. And then that metal bar really needs to be tight. Optimally, people are fitted ahead of time for an N95 mask, obviously because everyone's face is a different shape. This type of a duckbill mask works best for me. It's got that filter, so the particulates aren't going to be able to get through as long as that seal is good. So people, there are lots of different styles of these masks out right now. Some have a filter on the front, so knowing most of them are labeled with what kind of a mask they are. This is the kind of mask anybody who has COVID-19, we would want you to wear when you're caring for that person. These masks are reusable, so once you have your N95 mask, we're going to want you to keep that so that you can continue to use that over and over. If you have any questions about whether or not a resident needs you to wear an N95 mask while caring for them, please let myself know, Mallory, Jen, or the charge nurse on the unit. We will do our best to make sure that you have the appropriate fitting mask.
If you're working on a unit where you're only taking care of COVID-19 patients, how do you use the mask?
If you're working on a unit like that, you can leave your mask on from room to room. You aren't going to need to change it or take it off in between cares. You're going to want to leave it on as much as possible because that virus can be contained in the air. So when you're out on the unit, you don't want to breathe the air that's on that unit.
Okay.
All right, guys. Have a great day. Let me know if you have any questions. You're doing great.